We've all heard about the obesity epidemic that has been sweeping the country, affecting people of all age ranges, even children. It has become very serious, especially for those who fit the category of morbidly obese. They face developing diabetes, high blood pressure, heart disease, even death. Unfortunately, it would seem the battle to lose weight for many, however, has become a losing one. But there is hope, and many are finding it here at NYU Langone Medical Center in Manhattan. This is by far the busiest bariatric center in the country today. To learn about these procedures and their effectiveness, we visited with the surgical team, including Dr. George Fielding, who is one of the most highly experienced bariatric specialists in the world.
I was fresh from my training in laparoscopic surgery and bariatric surgery. There was nothing here at NYU. I started out with bringing on a nutritionist, psychologist, a social worker, a nurse practitioner, and myself. Brought George Fielding over, brought Marina Kurian over.
And in your practice, do you find that you do more lap band procedures than gastric bypasses?
I started doing many of the band surgeries because of the safety issue. Gastric banding requires a lot of aftercare, and I'm very happy to provide that for patients. Since we've done so many, now patients sort of refer themselves here because we're so experienced. We're the most experienced center in the country.
At 280 pounds, I knew that this was my bottom. I knew I had to either do something or I was going to die. I underwent lap band surgery with Dr. Wren as my surgeon. I lost 140 pounds. I've been reborn. My life has changed in so many ways. My husband loved me at almost 300 pounds and loves me still, but I did this for my health. And going out to eat is no longer me with my head into a plate, not even looking up. It's a social occasion, and it's a time to enjoy people around me. I so appreciate the fact that I've been given this gift.
The band is a silicone ring which has got an internal balloon, and it sits, we put that balloon right where the gullet meets the stomach. There's about 50 pathways that go to your brain controlling hunger. Some of them for sight, sound, taste, smell, all that sort of stuff, but 40 odd of them plus come from the top of your stomach. And that's why gastric stapling is done there, that's why gastric bypass is done at the very top of the stomach. The band wraps around this angle of the stomach, and there are receptors there that pick up pressure and fullness and all this sort of stuff. And for some reason in fat people like me, they just don't work. And that's why fat people are hungry all day long. It never goes away, and they never get full. And so this band, as you gradually tighten it, it squeezes. And something weird happens. You just stop feeling hungry. And then when you eat, you get full very quickly. And I think when you take a fat person and you make them not hungry, you're going to get a skinny person. And that's what happens.
Talk to me a little bit about your background and your experience with this procedure.
Of course, I'd give lectures to the public, and then I would take the surgeons through their first 3 operations. I'd go into the OR with the surgeons. This is the basics of looking after a lap band patient. I would go to their various hospitals, and I went all over the country. And then I came here to New York, and I really loved it here.
My mother always said I was the happiest baby alive. Piece of cheese in one hand, piece of bread in the other hand. And that was my life, food. Eating it, cooking it, shopping for it, baking, entertaining, everything dealing with food. I loved it. Gained weight steadily into adulthood, from teenage to adulthood. Got to the point, getting to the present, where my heaviest was about 470 pounds, and I was going to die, and said I have to do something. Did the lap band in July of 2007, and it was a miracle. Best thing I've ever done. It saved my life. I lost about 270 pounds in about 16 months. A miracle. It really changed my life. It was a rebirth. It changed my life 360 degrees. Dr. Fielding, from the first time I met him at the first interview, my first meeting, and he's become a friend. When he cares, he's always there when I call him. He's helpful, he's encouraging. He saved my life.
The great thing about the band is that there is no malabsorption. So every calorie you eat, you do absorb, but you also absorb all the nutrients. So in general with the gastric band, there's no malnutrition. Most insurance companies, when they look at patients who qualify for surgery, or if they decide who they want to pay for surgery, they have certain requirements. So does our program. We do look for a dietary evaluation. We have dietitians here that evaluate all the patients, but we also look for a psychological evaluation, and it's programmatic. We do it in our program, and also most insurance companies require that as well. And what the psychological evaluation is for, just to make sure that you understand what you're getting yourself into and that there's no compliance issues that I may not pick up during my office visit with a patient.
When I came to this hospital, and it happens that Dr. George Fielding was doing the seminar that day, and he had had the surgery, I knew immediately I was in the place where they understood who and what I was about. Then I also learned that he offered support groups to help you prior to the surgery and after the surgery. His entire staff was incredibly helpful. I was in the right place. This was the place for me. And I've lost 178 pounds. And if that isn't good enough, I've also come off of all of my medications. I was on 4 oral medications for diabetes, maximum doses. Nothing. I also took insulin. I took medication for high blood pressure and cholesterol. All gone now. Don't have to take anything. This is the most incredible tool. I do spin classes. I go to the gym and do weightlifting with a trainer. I'm happy. I'm living.
I meet with patients before surgery and do kind of a nutrition assessment and evaluation on them. Get a good sense of what's going on in terms of their eating behaviors, emotional eating, and otherwise before surgery. And then I do a diet education, help patients understand the changes that they're going to have to make to get ready for surgery, and then the diet progression afterwards. So that's all happening before surgery. And then in terms of following up with patients, I'll see them on an as-needed basis after surgery to help really maximize weight loss, deal with any nutritional issues that they're having, and kind of go from there.
I basically slowly put on 20 pounds the first year, took it off, put it back on, and this continued for about 25, 26 or so years until I was in my mid-40s. I actually saw Dr. Fielding speak. I was sitting there in the audience with my wife, and he's going through all the medical presentation of what the surgery is about. And then he says, I'm a lap bander myself. And he puts up pictures of himself before and after. And he's saying how tall he was. And I turned to my wife and I said, that could be me. I lost 20 pounds a month for the first 6 months. So within 6 months, I was 120 pounds lighter, which put me at 200, which was actually my goal. I felt if I can ever get back to 200, I'd be perfectly happy. Lost those first 120 pounds without any adjustment, which is why Dr. Fielding referred to it almost as the perfect surgery. I felt restriction and my hunger was quenched.
Coming out of the surgery, a few things is that they're going to feel full for the first time in their entire lives. And that just, the idea of feeling full and feeling satisfied from a small amount of food is going to be a new sensation. And kind of the beauty to that is the fact that they could eat these smaller portions, and it doesn't necessarily have to be a specific food type, like a specific diet food type, but they could actually have a small portion of something that they enjoy. They will feel satisfied with it. It'll give them nutritionally what they need, and it'll really help them just be able to lead a more normal life without having to worry about living with hunger and diets.
You can't eat as if you don't have it. If you just say you and I went out for dinner and you ordered a meal and I ordered a meal and you ate at your normal rate and I ate at that rate, I would puke. You just can't, it won't go down. So the success is completely dependent on coming for follow-up and eating slowly. And if you do that, 90% really get what they want out of it without a problem.
What kind of feedback do you get from your patients once they've gone through the procedure? Do you find that you've really changed their lives?
The feedback that I get from my patients is the main reason why I went into this field, and it's a big smile, happiness, a big hug, and knowing that their medications have gone down in dosage and amount. So it's overwhelmingly positive. It's like treating breast cancer. You don't just operate and then the cancer's gone. You have to treat it with medication, sometimes radiation, sometimes nutrition, and then you have to monitor it. So obesity is the same sort of disease. You can put it into remission, but sometimes the surgery alone is not going to help it. You're going to need adjuvant therapy, additional things that are going to help patients keep their obesity in remission. And sometimes it comes back. Sometimes the surgery doesn't work. Sometimes the adjuvant therapy helps. So each person is individualized, and we try to help them and help their disease on many, many levels. It's a really wonderful field to be in because basically I give patients their life back.
The story of how so many seriously overweight people have found success in their battle against excess weight through procedures such as the lap band, as performed here at the NYU Langone Medical Center. I'm Doug Llewellyn, reporting from New York.
Well, that does it for this edition of Close Up on America's Business. I'm Janice Marie. Thanks for joining us. We'll see you next time.